at some point. This is nice. Looks like it's got a lot of stuff still left in it. Let's start with a structure that is not found in the female and that we probably haven't seen yet. You see that little tube and this little tube. And they're coming in from the side, here and here, and they're circling around, going to join together and go behind the bladder and go into the urethra. So hand me the male and at least that part, yeah. I'll show you where we are. We're looking at this. What do you think that is?
Uterine tubes.
Yeah.
No? Ureter is
Vas deferens.
vas deferens, yes. This is spermatic cord where the vas deferens begins outside the body, goes through the inguinal canal where a man would get an inguinal hernia, and where the testes descended. By the way, why did they descend?
Gravity.
Get away from the body. For the sperm.
Yeah, sure.
That may help.
Oh, yeah,
Why does a
body heat,
person
that's
give
right.
birth? Gravity. Just stand up, they'll drop. That's to keep them cool, yeah, keep it cool. And then
And then they pull
this
up.
go up around here and enter the urethra right about at the, what's that gland right there?
Prostate.
Prostate. So we're looking at the inguinal canal as it, the vas deferens as it goes through the inguinal canal and behind the bladder. These are the two vas deferens on each side. Let's go back to the inguinal canal where they entered through. And to see that clearly, we're gonna have to sort of take this, each of these spermatic cords and lift them up. These spermatic cords come from the testes, and they're made of the inguinal, they're going to the inguinal canal. At the inguinal canal, the arteries and veins, see the red line? They will separate from the vas deferens. We already saw the arteries and veins are gonna go up toward the center of the body here. We saw them when we did the arteries and veins. And now we're gonna look at the inguinal canal.
So those are the, so I'm sorry, what is this? These are what?
These are spermatic cords. Is that
Spermatic
on the
cords.
list?
Yes, it is.
List, spermatic cords. And in there is a vas deferens.
Yeah.
So if you're gonna do a vasectomy, you're gonna cut a portion of this, but not the whole thing, because it's not there alone. You can't just cut the whole thing, because then you wouldn't have these blood vessels, which supply the testes with blood. Why do you wanna leave the blood vessels? Because the testes are still making testosterone, and you don't want to remove all the testosterone, you just want to do birth control. So you dissect a little bit and cut only the vas deferens. The other thing in here is, in the spermatic cord, are muscles that can raise and lower the scrotum, depending on the temperature. So what are these big things?
The
Spermatic
cords.
Cords. And in them, we're following the movement of sperm from the scrotum up through this point right here to the other side. Here's the vas deferens. Here's the artery or vein. The vein or artery goes that way. Vas deferens goes around behind the bladder.
That
And on
goes
the
to
other
the
side,
urethra.
on the other side here is the spermatic cord. Now let's look behind the bladder here. Here's our bladder. And what are some of the other things here? A tube coming underneath the vas deferens. What's that tube right there?
Just
Inguinal canal?
Now, inguinal canal has got to be a canal, not a tube. And the inguinal canal is right here. We just left it. It's
Or
this.
urethra?
That's the canal there. No, there's two of them, so it's not a urethra, but you're close. There's one on the right and one on the left.
Ureters.
Yes. These are the two ureters, and the two spermatic cords go over top of them. See that arrangement? Can you see that arrangement even from far away?
Yeah, I just can't find it on here, but okay.
Okay. So ureters,
They
Here
come
and
down
here.
from the kidney, right?
and they're coming down from the kidney. There's the kidney, the retroperitoneal kidney hidden up there. Kidney, ureters. What's this little thing here? that little round knobby is a
Bladder?
bladder. And take some of the fat off around the bladder. It doesn't really add anything. So there's our bladder
Yes.
and our
It's our little
vas deferens and our ureter is coming into the back of the bladder. Now when you pull the bladder this way forward, you can see the tube coming off the bottom of the bladder and peel off some of that fat I was trying to get rid of earlier. See in the front here, this tube,
That's the urethra.
That's
the urethra.
okay.
Now next we want to follow the urethra down a little bit, just because we haven't yet examined this pelvic area. We haven't seen the rectum, and without breaking the rectum, I like to look down there. So take this cutters and you go right on the pubic bone, and hopefully it can be cut without cutting too much of these. I don't really want to cut this.
No, because you'll need that one.
Yeah, I don't want to cut those.
Lab practical.
Yes, that's right. I don't want to cut those spermatic cords. I'd rather leave them intact. But cut down the bone. Where'd my bladder go? Did I cut the bone?
Do you want to cut this
Here.
one since there's not much left in it?
Oh yeah, that's probably a better one. You can follow. There, the descending. There's the bladder in it.
Yeah, that's about all that's left.
Okay, I'll go.
Oh, no, it's right there.
Oh, good. I didn't think I cut it off. But she has a good idea. If we're going to be doing some major damage, possibly, this should be the cat on which to do it. This is the pubic bone that we're going after here. These are bone cutters, so it should be possible to cut down pretty low along here, removing the muscle from the legs and kind of opening up here. So you can see everything as you go down.
Hurts my hips.
Now he's really doing a side stretch. So what is this right here?
That's your urethra.
Urethra at the bottom of the bladder. Now this urethra is the same size as you're going along it until the vas deferens join it. They're coming in from behind, and make it a little bit bigger. And at that point, it is going to be called, it's going to be around the prostate gland. The prostate gland in the cat is about an inch down. In the human, it's right underneath the bladder, but in the cat, you have to go down a ways. I don't know if we're gonna,
That's quick cats.
I don't know if we're gonna see the,
Done.
yeah, this cat is not gonna give us a lot more information, so we're gonna let it.
Hello, die. I hope that's me one day.
You
Helping
donating?
people learn. Yeah.
Yeah, it's a nice thing to do, it is. It changes right about here. It gets a little circle of darker color, a little bit bigger.
That's the prostate.
That's where the prostate is. You usually feel it better than see it. It gets a little bigger down there, about an inch down. Can point out the prostate on here is right next to the bladder.
So that's after the vas deferens joins the urethra. That's the next section, if you will, that comes up.
Well, let's see, the vas deferens in a human goes right through the prostate to get to the
Right.
urethra. In the cat, there's a space here, and then the vas deferens joins the urethra a little lower. Let's see if we can see where the vas deferens are at this point. They're behind here, these little tubes here, and they're trying to join up with this prostate down here.
It's going to be a lot harder than arteries and veins.
And here's our vas deferens here and here. There they are. Those are the vas deferens. They're going behind the bladder. Pull the bladder forward a little bit, and you can see that they're coming close to each other. They're coming like a V there.
Mm-hmm.
And they're going to both join up with the urethra.
Thra.
Right here. And I will,
The vas deferens comes from the testes.
yes. So now we should probably find the testes. So this is a vas deferens. See when I pull on it, you can see that
How sperm is.
V up here moving.
Where's the ureter again?
Ureter goes from the kidney, which is not so much here anymore, but there's a piece of it here. It's been broken, to the bladder. In here, the bladder is got a start of a ureter here and the start of a ureter here, but in this particular one, they're cut before they reach a kidney. So they come in the back of the bladder. In the front, is the best place to see the urethra. And right now, the next thing to do is to look for the origin of the vas deferens. It should be coming from the testes, which should be in the scrotum. Usually you can feel the testes in the scrotum. I think there might be one here, but it won't be, sadly, it won't be connected to its spermatic cord, because I did break the spermatic cord. So let's try the one on this side. Trace it down to its spermatic cord. Oh, there it is. And you can't miss the appearance of the testes because they're shiny, just like the ovary was in the female. If you had a female and saw your ovary. It's really kind of tight there onto the scrotum, but it's going to come separated in a minute.
Does it hurt, guys?
Yeah.
Poor guy.
Something about it.
Okay, it's going to come free.
Pulling and it cut it.
Okay, this is the testes and this is the spermatic cord. And as soon as it went through the inguinal canal, it's separating from the arteries, and it's going to be called the vas deferens.
Is the spermatic cord only for sperm?
No, the spermatic cord has several functions. One is to carry sperm, and the other is blood is in there for feeding the testes so they don't die.
Is that also the same veins that the testes will be sending the testosterone through?
Yep.
You said movement of sperm from the testes to the vas deferens and blood what?
This is going to move, here's our spermatic cord.
Right.
This thing is going to move, the thin piece going this way is moving the sperm. Here are the arteries and veins moving blood to feed the testes.
Thank you.
And they separate right, you can see them going into two sides there. We don't need to keep them attached to each other. This V shape here occurs right about at the inguinal canal when it first enters the body wall. Okay, how about this? This is covered, the testes are covered with a connective tissue covering, a tunic. And inside the tunic, you have another structure right next to the testes called the epididymis. So if you point out on the, where's the human model? Epididymis? Where is that?
You flip it.
Flip it, yeah. It looks better on the outside. The testes are white, the epididymis is pink, and goes up along the testes, yeah. So after the sperm are made in the testes, they travel to the epididymis. And in the epididymis, they mature a little bit, and then they can go up the spermatic cord.
It's not, it is wireless.
Hmm?
What are the testes made out of? Like tissue-wise?
Well, the seminiferous tubules that make up the testes, their walls are actually cells becoming sperm. They start to be made. Those cells are cuboidal in shape, but they're different than simple cuboidal. They're going to become sperm as they mature, and then they'll move along the wall there. Here's the piece on the edge right here is the going around this way. We have that. Now we have to look at the little bit that looks a little different right there. Looks like a band going that way. That's part of the epididymis. Epididymis doesn't show great on that particular testis. We probably want to know where the sperm, they come from here, up the spermatic cord, through the vas deferens, then the vas deferens come behind the bladder. They join together and enter the urethra. Here they are behind the urethra. They're going to enter the urethra. Once you've entered the urethra, you still have to get the sperm to the outside, right? We need a way to get from the urethra to the outdoors, opening, and this will start from the other end. We'll start at the penis and work backwards. Penis on the cat, this cat isn't very big. It's just a little, there's the opening. You see a little opening there, a little hole? Right there. Let's see if we can do what does he need? He needs to remove some of the foreskin. We'll do like a Jewish ceremony.
Circumcision.
Circumcision.
Yeah.
Testes right here.
Yeah.
There's a lot of problem with circumcisions now in the
I wonder why.
in the part where you after the circumcision where the rabbi
So she just
can there's a part of the thing there where they can transmit herpes, and that's really not a good thing.
Wait, what?
How do they transfer herpes through circumcision?
There's something that involves sucking on the part of the rabbi.
What?
Yeah, there is. He puts his mouth there and takes up some of the blood. It's
Whoa.
kind of sad, but
What if the baby?
the
has
baby
HIV? Like,
then the baby gets a disease. There's no reason other than religion for that, or I don't think there's any health
That's
benefits.
Yeah.
That is-
sick. Sad.
There's this little, take a look at those little glands right at the end. He's had a circumcision now. It's not very little teeny glands.
Little teeny penis.
good thing you're not Jewish.
It is. Oh my gosh, I would be in trouble now, wouldn't I?
Yeah. So
I'd be
You
talking
know what
about
comes
the
next?
whole part where the
these are the glands right here.
what glands?
Those.
Oh, that there's only one gland.
Okay.
Well, pointed out on the model there. The glands, penis is the tip end,
Okay.
just up to where it gets thicker there. There's only one per. Okay, I think that's enough for the male. Let's look for the female. Oh, let's look at the human and make sure we found all the parts on the human. And I'll take the whole thing.
Are we gonna have corpus spongiosum and
Yeah, read the list and we'll.
okay. So we did scrotum, testes, epididymis, spermatic ducts.
Okay, scrotum, you saw the skin. Testes, the white. Epididymis, the pink. If I got that?
Yeah.
Yeah.
Okay, next.
Spermatic duct,
Spermatic duct is another name for, isn't there another name by that?
vas deferens and ductus
Yes,
deferens.
spermatic duct, vas deferens, and ductus deferens goes all the way around there.
Very nice.
Okay, what's the next thing?
Spermatic cord, which can
Spermatic cord only goes from here to here, and the spermatic duct or vas deferens is part of it for the first 5 inches in the
That would be what's pinned
vas
here.
deferens. Yep, that's your spermatic cord there.
Cord.
And this with the red, blue, and the pink of the vas deferens is the spermatic cord in the human, right here. And this is where you do a vasectomy, cut the vas deferens right here. Don't go inside the body past the inguinal canal.
And then where's the muscle?
Cremaster muscle. Some of these models show a muscle, but I don't see it. It's just another thing that would be traveling in here. Next
Inguinal canal.
space you're going through right there. It's the space right here.
And basically, inguinal just means
Yep,
here.
that area.
And that's where you would have a hernia?
Yes,
Yeah.
because when the testes went through, that there's a little weakness in the body wall there. There's the muscle. I think that's external oblique muscle, and there's a little weakness to it.
Ampulla of ductus deferens.
So let's follow this vas deferens or ductus deferens or spermatic duct all the way back here past the ureter. There's a ureter coming into the bladder. Past here, and it starts to get wider here. That's the ampulla of the vas deferens. Ampulla means a wide area. Okay,
Ejaculatory duct.
now we go through here, and the part of the vas deferens here that goes through the prostate is called the ejaculatory duct. It's the last inch or so of the prostate, and it's going three-dimensional, so that's why it looks like it's short. But
So
it goes all the way from here through the prostate to the urethra.
so it's only this part then of
Mm-hmm.
that.
Goes from there to there after the ampulla ends here.
And what exactly is the function of the prostate?
It adds fluid containing fructose to help feed the sperm. It adds some stuff to keep the pH correct. And what else does it add? Fluid, just volume to the semen. So it helps to make semen. Seminal fluid to help to make the whole.
Okay.
Ejaculate.
So ejaculatory urethra with the
Parts.
prostatic urethra.
Prostatic urethra goes through the prostate. There's a lot of holes where it adds its fluid. Membranous urethra goes through this very important membrane. This is the bottom of the, between the legs that keeps everything falling out. So you have to have a muscle here. And that's that membrane or muscle. Penetrates that, and then from here, all the rest of the way is the
Penile?
penile urethra. Okay, next part.
Penis.
Everything from here all the way out. And the corpus,
Spongiosum.
we have two corpi, you might say, spongiosum and cavernosum. The whole, they show better here. See how that looks like a sponge for the whole glands and the area around the urethra? That's corpus spongiosum, that reddish spongy stuff. Cavernosum is what you see in purple here. It's not in purple on every model, but there's big blood-filled caverns that can fill with blood for the corpus spongiosum.
For the erection.
Yes, for the erection, the spongy area, spongiosum fills with blood, and the cavernosum fill with blood.
Glans penis.
Glans penis,
Glans penis.
that's what we were showing when we did the, when we took off the foreskin, circumcised the cat.
So that's just the penis head?
Yeah. Good way to praise it. Try not to get in trouble here.
Precipice, the foreskin.
The foreskin prepuce, we don't, oh, we have that on here. This is a half and half, circumcised on that part, not circumcised here. See the foreskin covers the glands up here.
As long as we don't have any.
So that's got a foreskin. Next part,
Accessory glands, prostate.
prostate, we've seen a few times. We'll talk more about its function, but adds to the seminal fluid.
And seminal glands, or the seminal
Vesicles. They used to think these stored sperm. That was a mistake. They don't. Here they are. They add fluid also.
Is it always
To the
right next to the
Definitely.
epididymis? No, not
Right
epididymis.
by the ureter and the vas deferens. It's all right next to the vas deferens.
And that's the what?
Seminal
Seminal?
vesicles. Used to thought to be vesicles storing semen. Now, then they found out they don't store anything. They just make fluid that adds to the ejaculate. Anything else?
Nope.
No, that's it.
Okay, let's look at the female. Do we have time? Yeah, we have time to. Let's look at the female model.